Hello everyone, I am Dr. Shankar Dey. Welcome to third session of INICET 2022 May recall questions discussion. So starting with question number 21, a patient with single hypopigmented hypoaesthetic plaque and along with one thickened nerve presented to you, what will be the management protocol for this patient? So this is a case of nothing but a leprosy, as the patch was single hypopigmented and hypoaesthetic patch along with one thickened nerve. So this is definitely is a case of posibacillary leprosy. As you know, there is two type of leprosy, posibacillary and multibacillary. You should know the difference between posi and multibacillary leprosy, how to differentiate them. So this is a case of posibacillary leprosy. So what will be the management? In this image there is two drug kit, one is A, another is B. As all of you know, this B is the smaller kit is for posibacillary leprosy and this larger kit is for multibacillary leprosy. So this kit contains drug for 1 month. This is for B is for posibacillary and A is for multibacillary leprosy containing 1 month drugs. So as this question is about posibacillary leprosy, then I will use kit number B, the smaller kit. So I will use the green or smaller kit for total 6 month duration. For posibacillary leprosy treatment, 6 months duration with this posibacillary kit. So the answer in this case is B for 6 months, kit B for 6 months, smaller kit for 6 months. So this is the answer, B for 6 months for in this case for treatment option of this question. Next, coming to question number 22. Question number 22 is about the rearrangement of structures involved in auditory pathway. As all of you know, the popular mnemonic of auditory pathway, that is ecolema. So what is the full form? Just tell me. E for, yes, E for 8 nerve. So E for 8 nerve or 8 nerve or vestibulocochlear nerve. C for cochlear nuclei. So 8 nerve cochlear nuclei. O for superior olivary complex. Superior olivary complex. L for lateral lemniscus. So L for lateral lemniscus. I for inferior colliculus. Inferior colliculus. M for medial geniculate body and A for medial geniculate body and A for auditory cortex. So this is the pathway. This is the pathway for auditory pathway from proximal to distal. So this is the auditory pathway, ecolema, 8 nerve. As you can see here, this is 8 nerve, 8 cranial nerve. So 8 cranial nerve is starting for here. This is 8 cranial nerve. Then 8 cranial nerve goes to one goes to cochlear nuclei, then superior olivary nucleus. This is superior olivary nucleus. Then from superior olivary bilateral superior olivary nucleus, it goes to after superior olivary nucleus, it goes to lateral lemniscus. This is lateral lemniscus. Next, after lateral lemniscus, inferior colliculus. This is inferior colliculus. Then medial geniculate body, then auditory cortex. So this is the pathway. The mnemonic is ecolema, very popular mnemonic. So this was the question of last year INICET, rearrangement of the structures involved in auditory pathway. So from 8 nerve to auditory cortex. Now coming to question number 23, which is restricted in maple syrup urine disease or MSUD. So maple syrup urine disease is a deficiency disorder of branch chain ketoacid enzyme defective. So in this case, branch chain ketoacid dehydrogenase enzyme is defective. That's why branch chain amino acid metabolism is hampered. So what are the branch chain amino acid? leucine, isoleucine and valine. These are branch chain amino acids. So because of this defective enzyme, the metabolism of this enzyme hampered. So what are the clinical features of maple syrup urine disease? Like failure to thrive, feeding difficulty, lethargy, convulsion, hypotonia with bouts of hypertonia, and one special features, urine smell like maple syrup or burnt sugar or caramel. Urine smell like maple syrup on refrigeration. That is why this disease is named as maple syrup urine disease, and diagnosis is made by estimation of branch chain keto acid. So branch chain acid and keto acid is elevated because of defective enzyme. What is the treatment? Treatment is restriction of these food products containing leucine, isoleucine and valine, and supplement the thiamine. So I have to restrict all the branch chain keto acids. So what are the branch chain keto acid among these four options? That is valine, leucine and isoleucine. So I have to restrict these three amino acids. So which is restricted? The question was about which was not restricted in maple syrup urine disease. That is, the answer is methionine. Rest of three amino acids are restricted because these are branch chain. So the answer is methionine. Methionine is not restricted in maple syrup urine disease. Next, coming to question number 24, it was image based question. As you can diagnose from the image, this is a trophic ulcer. This is a trophic ulcer, or also known as neuropathic ulcer. Neuropathic ulcer can be seen in diabetic patient because of diabetic neuropathy. So true about this ulcer. In number one is absent distal pulses. Absolutely no. This is common in arterial ulcer. Decreased sensation, yes, because this is neuropathic ulcer. So this is the answer. Decreased sensation is seen. Next, positive Trendelenburg test. No, this is positive for varicose ulcer. Pain on passive movement of leg. This is also wrong. So only true about the trophic ulcer or neuropathic ulcer is decreased sensation. Coming to question number 25, a 25 years old male following road traffic accident presented to emergency department with GCS 3. As you can see, the lowest GCS means E1, V1 and M1. So NCCT brain drawn and NCCT brain found to be normal. Although the patient GCS is very poor 3, but the NCCT brain is normal. This is repeated question from previous INICET paper or AIMS paper. This is a typical case of diffuse axonal injury. In this case, NCCT brain may be normal, but patient presents in comatose condition with poor GCS, like in this case GCS 3. So this is typical case of diffuse axonal injury, DAI. This is repeat question from previous question paper from INICET. So this is column matching question. Match the column A with column B. In column A, various gene is given, and in column B, disease related was given. So I have to match the column. First gene is Plaque 1. Plaque 1 is related with pleomorphic adenoma. So this is, the answer is pleomorphic adenoma. MYC gene is related with Burkitt's lymphoma. MYC gene related with neuroblastoma, and RB gene is related with retinoblastoma. So this is the answer. Plaque A with pleomorphic adenoma, CMYC with Burkitt's lymphoma, MYC is with neuroblastoma, and RB gene with retinoblastoma. Next, coming to question number 27, all are the AIDS defining malignancy except. So this is very typical question. As you can see, the first one is non-Hodgkin lymphoma. Yes, non-Hodgkin lymphoma is one of the AIDS defining malignancy. Invasive cervical carcinoma, this is also a AIDS defining malignancy. Also Kaposi sarcoma related with HHV, human herpes virus A, this is also a AIDS defining malignancy. But melanoma is not AIDS defining malignancy. This was a question given from the table or chart, very important table or chart given in Harrison. You can follow the Harrison's table, the age defining illness, where you can find the age defining malignancy. First three are included in those list, but melanoma is not included. So melanoma is not the age defining malignancy. So straight cut answer is melanoma. Next, coming to question number 28, very straightforward question with image. What identify the specimen? Is this a carcinoma of gallbladder? Absolutely no. Is this cholelithiasis? No. Is this multiple polyps? Absolutely no. So what is the answer by excluding the other three options? This is obviously strawberry gallbladder. This is also known as specimen of cholesterosis. So cholesterosis of gallbladder looks like strawberry, also known as strawberry gallbladder. Straightforward question. Next, coming to question about Meckel's diverticulum. Ectopic tissue present in Meckel's diverticulum are thyroid and gastric tissue. No, thyroid tissue is not present in Meckel's diverticulum. Colonic and pancreas, not colonic tissue, pancreas tissue can be there. Gastric and pancreas, colonic, as I told you before, not colonic. So the option is gastric and pancreas. So this is the answer. Ectopic tissue in Meckel's diverticulum is gastric and pancreas. So let's learn about this Meckel's diverticulum. As you can see in this image, this protrusion from the antimesenteric border of the intestine is Meckel's diverticulum. This is nothing but remnant of vitello-intestinal duct situated in antimesenteric border, as this is mesenteric border, but this is situated in this border. This border is antimesenteric border. As all of you know, this is true diverticulum because it contains all the layers of the bowel. So this is true diverticulum, not pseudo diverticulum or false diverticulum. As all of you know, the rule of 2 related with this Meckel's diverticulum, it is seen in 2% population. It is 2 inches long. It is situated 2 feet proximal to ileocecal junction, and 2 types of ectopic mucosa is seen in this Meckel's diverticulum. One is gastric mucosa and another is pancreatic mucosa. You should read all the details about Meckel's diverticulum from your surgery topic, about the diagnosis, per-technet system EV scan, technetium 99 per-technet scan, management protocol like diverticulectomy or laparotomy, when it is done, in what cases. You should read all the things related to Meckel's diverticulum from your surgery from the subject surgery. Next, coming to question number 30, which clotting factor is reduced in pregnancy? As all of you know, factor 12 reduced in pregnancy, factor 7 increased, factor 9 increased, factor 11 increased. So which clotting factor is decreased in pregnancy? That is factor 12. So this topic is very important. So what are the hemodynamic changes in pregnancy, what are the respiratory changes in pregnancy, and what are the cardiovascular changes in pregnancy? So these topics are very favorite topic for the INICET examiner. So for near INICET examination in future, so you should read all the changes related to pregnancy, hemodynamic, respiratory and cardiovascular. In the upcoming NEET exam also, you can expect 1 or 2 questions from this pregnancy changes. So you should read the topic very well. So in the next session I am going to discuss question number 31 to 40. So stay tuned for the next video, and don't forget to subscribe the channel Dr. Shankar Dey. So share the video with your friends, seniors and juniors. Thank you very much for watching.